It's not easy to talk about cancer, yet knowing your family's history of cancer is a first step to understanding your own risk and may qualify you for genetic testing that can inform your way forward. MyRisk Hereditary Cancer Test with RiskScore from Myriad Genetics is a powerful tool to help healthcare providers identify your risk of developing 11 different types of hereditary cancer. And RiskScore analyzes multiple factors to estimate the risk of developing breast cancer over the next 5 years and remaining lifetime. Learn more about MyRisk with RiskScore at getmyrisk.com.
Hi, I'm Dr. Aliabadi. If you struggle with irregular cycles, acne, facial hair, body hair, hair loss, or insulin resistance, you might be dealing with PCOS or polycystic ovarian syndrome. Having dedicated my life to helping women with PCOS, I understand the challenges in getting an accurate diagnosis and the right care. That's why I created Ovi, a science-backed alternative to prescription medications. Ovi is designed to help you take control of your health with clinically proven, validated ingredients in a simple, once-a-day solution. For too long, women with PCOS have had to choose between lifelong prescriptions or complicated supplement regimens. Ovi offers a better way to help manage your symptoms without the hassle. It's my mission to empower women facing PCOS and other hormonal issues by providing the information and support they need. Reclaim your health once and for all. Go to ovi.com. That's ovii.com and start today.
I've been hearing from so many people for the last year about this incredible woman sitting across from me, Tamsen Fadal, and Dr. A and I are always talking about there are women warriors in the health space. And I really, really, really think that you are in terms of what you have done, where you have taken your menopause journey. I just want to say thank you for all of that. And then thank you for being on our podcast.
Thank you for everything you're doing. Please.
It's so funny because when I was looking in your book and the documentary and when I got really deep in there, I was like, we have all those people on our podcast. They are the best. Like, Mary Claire Haver and Kelly Casperson. So when I was doing the research and watching the documentary, what really struck me was Dr. Lisa Mosconi, what she said, which is a woman's life is celebrated. You're born. Everybody celebrates. You have your birthdays. You have your first period. You have your first baby. You have parties over this. And all of a sudden, you go through menopause and nobody talks about it. No celebrations. In fact, it is really until very, very recently, nobody says a word. So I thought that was really interesting. There are some societies where menopause is really celebrated and it's a beautiful thing in these societies. And those women have less severe symptoms than we do in America.
I think just in general, it's wrapped around aging. Obviously there are some cultures that are like
Celebrate.
Celebrate wisdom, celebrate age, celebrate experience. And, we don't happen to be one of them, unfortunately. I'm hoping that shift is happening at some point, but
your Lebanese side is, right?
My Lebanese side does.
Yeah, because my Persians, I'm
course,
Persian, and
of
we
course.
celebrate elderly and we love them. There's a study that says the children who spend more time with their moms tend to live longer.
Yeah.
I mean, these are, do you know what I'm saying?
Oh, totally. Yes, I do. And I believe it.
So I want you to tell our listeners the exact name of your book and the exact name of your documentary and how everybody can find both.
I can't wait to read it and watch it.
You're so sweet. The book is How to Menopause, and the documentary is The M Factor, Shredding the Silence on Menopause. Because I think
Love it.
the most important thing for us was the film to start conversations. Like, that's what we really cared about.
Yeah.
And that's what's happened. It's been in over 400 cities and 43 countries. And all of it's at tamsenfadal.com. What we did originally is, for the first several months, is give it away. So there could be community screenings everywhere. And so that's really what's been going on. And we have now some virtual screenings that are happening. But the community screenings were interesting because I had a party recently called the World's Hottest Menopause Party. And we brought
I saw that.
That's awesome.
I said to Dr. Lisa Mosconi, you said we don't celebrate. We should celebrate.
I know.
But we brought in groups from all over the place, like India, in Jamaica, in Canada, in the UK. It was unbelievable, and women had all come together as a result of the documentary. And so it's really special to me to see, because we're all going through the same thing. Like, I don't think ever in our lifetimes I've never been a part of something where all these women are going through it together, and there's such a community, and there's such a sense of sisterhood that I've never ever been a part of that before.
You know, you started off your career as a journalist, and then, you know, we're on the floor with your menopause symptoms. Can we start with your own menopause journey?
Yeah, it certainly has been one, right? Well, first of all, thank you for having me, because I think that this conversation is one that we can't have enough. Every time I think that, oh gosh, everyone's probably heard this, I realize not everyone has heard this. There's a billion women out there that are in menopause this year. And so I really, I didn't understand how big this, time in my life was going to be, this story was going to be, this, everything that we have going on. But I did news for 20, almost 30 years as a news anchor. And one night we were in commercial break. Everyone was kind of just fooling around talking. And all of a sudden something came over me where I was like, oh my gosh, I think I'm going to fall over. Like, I was hot. My heart was racing out of control. I could hear it in my ears. I'd had what I realized later was brain fog, like problems with words and word retention, and looking at a word and can't be able to pronounce it. But I didn't know what was going on here. And I said out loud to all men that were in the studio, if I fall over, somebody catch me. And half joking, half like, oh gosh, I should let them know something is weird, but I don't know what. So the sports anchor walked me off the set. He goes, I think you should get off the set and just calm down for a minute. I got off the set, I went to the bathroom, went right down to the floor. And I got up after that and I was fine, but kind of freaked out. It was the first time I'd not finished a broadcast live and didn't know what had happened. And I subsequently went to doctors, not to an OBGYN.
Were you having periods still?
No, but I have endometrium polyps, so I was still bleeding.
Okay.
I didn't realize they weren't periods because I was bleeding all the time. So I had very, very heavy periods for a long time in my mid-40s, but I'd gone through a divorce. So I thought, well, everyone's like, it's stress. You got to calm down. You're bleeding like this. It's stress. Went on Lexapro. All the story that I now heard so many women have, but at that time, I'm like, oh, it's so unique to me. So the bleeding that was happening, there was bleeding, but wound up being endometrium polyps.
How old were you at this point?
So I was 49 at this point. So I was average age. I had just no idea. So I went to a couple of different doctors and endocrinologists, then finally my OBGYN, and did a blood test. And my OBGYN who I'd had for years, put a note in my patient portal that said, in menopause, any questions? And that was kind of where my journey started. I think the most shocking part to me was like, how could I be in menopause? I'm too young for that. And like, what? But I just didn't know what I didn't know. And that's really where my journey began. And so many women's journeys have begun like that too.
So you weren't on hormones at this point at all? Because
no,
obviously
no,
you didn't
no,
know.
no.
It's so interesting. One of the other things in the documentary, somebody said, I can't remember who said it, but she said, our mothers didn't talk about menopause. And so they just suffered in silence. Like they weren't even taking hormones. No one was taking hormones our mother's age because of the Women's Health Initiative.
Right in between. Yeah.
So when I finished my residency from County USC and I started practicing before the WHI study, every single woman that would walk into my office, we would prescribe hormones. So
that was
back
before
then,
the study?
Before the study.
Yeah.
So I would have an 80-year-old walk into my office. And I'm like, you're not on hormones? So it was very common to give hormones at that point, actually. So a lot of people were on hormones. And then this study came out and it was like a complete stop. And we stopped prescribing it for many, many years until we realized the study had a lot of issues and we started reintroducing hormone replacement. The problem is the fear that women still have because of that study is really big. I went to the second best program in the nation, which was County USC at the time for OBGYN residency. And my exposure to menopause was maybe 2% of what I learned.
Stunning.
I learned to be a very good surgeon. I learned to be a very good OB. I could do a hysterectomy laparoscopically. So I was very advanced in everything else, but very few people would talk about menopause with us. And even fertility was more covered than menopause. So I kind of learned menopause by seeing patients and having these patients walk in and complain. And I started reading and educating. Well, because of women like you, now more and more people are talking about it. And women now know that they don't have to suffer in silence.
I've actually never told my mom just how sad I am for her that she had to go through that and they had to suffer.
They didn't
through
even
this
know
in
what was happening
silence.
to them.
No, I mean, I can actually picture, like, I can remember looking at her and she's in my mind, just seeing my mom being like, what is wrong with her? Why is she like,
Wow.
And so as we go into this phase of life, nobody talked about it, you know, until really recently. It's become something that everybody's talking about, which I'm so happy about. You know, we're hopefully doing the same thing for PCOS, which is another, you know, silent, you know, 75% of women have it. That's why we created Ovi. But so that happens. And then you pick yourself off the floor in the doctor's office because you're like, oh my Lord, I'm in menopause. And then you go to what?
I went back to my OBGYN who said, like, you know, there's a lot of different things you can do. You got to figure out what's best for you. But your mom had breast cancer, so I don't really know if hormones are your solution. Which I've now found out that that's not the case, and I actually am on hormones.
It depends.
Right.
Yeah.
But I did never have breast cancer.
Right.
So I just had a lot of misinformation and a lot of fear wrapped around it. So I wound up finding a new gynecologist and dealt with the polyps, and originally was given hormones, but I was still very scared. So I let those sit there for a while. And then I was just really having debilitating symptoms. Like really, and probably for me, lack of sleep and that brain fog was the worst. Hot flashes were not comfortable, but the brain fog was bad. Like I wouldn't have been able to continue on a conversation. Like I just couldn't do it.
So Thaïs, will you talk to us a little bit about the brain fog? Because it shocked me. One day you said that 80% of women in menopause have severe brain fog. And does it come back?
You know, symptoms of menopause can start 7 to 10 years before menopause. So average age of menopause is 51 and a half. 7 to 10 years before that, women can start experiencing symptoms. And that range is 45 to 55. So if you're going to be menopausal at 45, your premenopause symptoms can start as early as 35. You might have vaginal dryness. You might have hot flashes. You might gain weight, hair loss, brain fog, irregular periods. And that's when it gets so confusing, right? You have a 37-year-old. Is it PCOS? Is it her thyroid hormone? Is it premenopause? That's why it's so important to listen to your patient, you know? And unfortunately, because doctors are busy now, you have to empower women to be their own health advocate, 100%. Know about symptoms of premenopause, brain fog being one of them.
What are the symptoms of premenopause?
It can be, you can start from head and end up at your toes. So irregular period, hot flashes, night sweats, brain fog, hair thinning, facial hair, vaginal dryness, painful sex, weight gain, sleep disturbances, joint pain. I mean, there's so many. Itchy skin, everything. Anxiety, depression.
And you don't have to have all these. You can just have a few of these.
And different people have different symptoms. Some patients have regular cycles and boom, they stop. Definition of menopause is no period for 12 months. So some people are regular, and it stops. Other patients are all over the place for many years before their periods go away. So every single patient is different. Obviously, someone with endometrial polyp at 49, you're still premenopausal. You have premenopausal bleeding, but because polyps also make you bleed longer and they cause mid-cycle bleeding, then you end up bleeding all over the place.
Yeah. Even now, I have polyps, and so that'll just pop up all of a sudden. I'm like, oh gosh, got to get them removed again. So it's very confusing for me. And I shouldn't be doing that now.
So yeah, as long as you do your ultra, usually at menopause, if you remove and do a good scraping of that lining, they should not come back.
Mine come back much smaller.
Yeah.
But they still come back, and it's much a longer spread of time.
Right.
So it used to be, once I started this, I was like,
pelvic ultrasounds. That's why I do pelvic. I keep saying
every time a patient comes in, she does a pelvic.
Oh, wow. See, I'd never had that until I started the regular bleeding.
No, I do it on every single person.
Wow.
Every single person.
You know, as an entrepreneur, I've realized that making money is one thing, but managing it, well, that's the real game changer. Starting 2 companies at the same time had my mind going 1,000 miles a minute with expenses here, unexpected costs there, and I was constantly wondering, where did it all go? Then I found YNAB, and it's completely changed the way I handle my money. YNAB, spelled YNAB, is a life-changing app that helps you do what you want with the money you have. You'll create a flexible plan for your money through the simple practice of giving every dollar a job, keeping you focused on the life you want. Now, I can invest in my business, cover my bills, save for the future, and still enjoy a good dinner out without feeling guilty. And I'm not alone. 92% of YNAB users report feeling less stressed about money. Plus, the average user saves nearly $600 in their first month and $6,000 in their first year. If you're ready to stop wondering where your money goes and start deciding where it will take you, listeners of the SheMD podcast can claim an exclusive 3-month free trial with no credit card required at www.ynab.com/SheMD. That's ynab.com/SheMD. Life is short, spend it well. I don't know about you, but my life is basically one big to-do list. Between work, family, and trying to have some kind of social life, I barely have time to think about what I'm eating, let alone if I'm getting all the nutrients I need. That's where Symbiotica comes in. Their products make staying healthy effortless, even when your days are packed. I'm obsessed with their liposomal vitamin C. It helps with immunity, supports collagen production, and actually tastes good. Citrus vanilla, yep, it's delicious. Plus, with their liposomal technology, my body actually absorbs the nutrients instead of wasting them. And the best part, it literally takes no time. I throw a couple of their travel-sized packets in my bag and boom, healthy habits handled. I just grab a travel-sized packet, take it, and move on with my day. No messy powders, no handful of pills, just easy. No more forgetting my supplements or stressing out about what I should be taking. If you're busy but still want to take care of yourself, this is it. If you're always on the go like me, this is the simplest way to take care of yourself. And right now, SheMD listeners get 20% off plus free shipping. Just go to symbiotica.com/SheMD. That's symbiotika.com/SheMD. Seriously, it's the easiest healthy habit you'll ever start. Trust me, your body will thank you. Have you ever had that gut feeling that something is off? For me, it wasn't just a feeling, it was my actual gut. Bloating, weird energy crashes, and no matter what I ate, I really didn't feel great. Then I found Zoe, and it completely changed the game. Backed by one of the world's largest microbiome database and the most scientifically advanced at-home gut health test, Zoe gives you proven science whenever you need it. And it shows me exactly what's happening inside my gut. Turns out some of my microbiome wasn't happy with some of my go-to healthy foods. Everyone's body is different. Everyone's gut is different. It was so amazing for me to actually have a tool that was backed by science that I could use to figure out what foods were right for me. I got the Zoe test back and I really understood what foods I should be eating and what I shouldn't. With Zoe's personalized nutrition program, I finally got a plan that works for my body. And the best part, I actually feel the difference. No more guessing, no more one-size-fits-all diet, just real science-backed food choices that made me feel amazing. As a Zoe member, you'll get an at-home test and personalized nutrition program to help you make smarter food choices that support your gut. That's Zoe.com. Zoe.com. Use the exclusive code SheMD10 to get 10% off membership. That's code SheMD10 to get 10% off. Trust your gut, trust Zoe. And when do you start hormones?
It depends on the patient, right?
Okay.
It depends on their symptoms. If someone shows up at 45 and their only issue is irregular periods, you can put them on a birth control pill, right? But if someone comes and says at 43, I have brain fog, I don't feel well, I'm anxious, I'm not sleeping, offer them hormone replacement therapy. Again, it goes back to listen to your patients, see what symptoms bother them. If it's decreased libido, another complaint, very common complaint, a lack of energy, you can give them testosterone before starting hormone replacement. Do you know what I'm saying? So you have to listen, and we address the symptoms. Not all the symptoms of menopause are resolved with hormone replacement. For example, the weight gain, they might need GLP-1s in addition. They might need metformin if they have insulin
Or
resistance.
OV.
Or OV, yes.
Well, it seriously
It does. So that's the general rule. You can't say everyone go into this basket and I'm going to give everyone hormone replacement. I don't do that. You actually have to be careful. Going back to family history of breast cancer, I love talking about that because every single woman on this planet needs to know her lifetime risk of breast cancer. Do you know your lifetime risk of breast cancer?
I don't. I just know that they did it on a little calculator, but I didn't know that was a thing you do. So she pulled out a jeweled calculator, like from 1980.
What is that number?
I don't know what the number is.
She wants
now.
every
It's like-
woman to know.
Yeah.
So why
6
is
years
that?
ago, but I know I don't have the BRCA gene. Which
So
is,
two things I want to teach you today. Number one, the BRCA gene is two of the oldest genetic. There's
And
so
small
many
percent,
gene
right?
mutations right now associated with breast cancer that are not BRCA. PALB2, CHEK2, the list goes on and on. So BRCA is just two of the cancer causing genes. Anyone with family history of breast cancer needs to do a full panel genetic testing, number one. If you come to my office as a patient, I do the MyRisk genetic test. Why is it so important? When you do the MyRisk genetic test, you get 3 information from it, which is very important for someone with family history of breast cancer. Number one, we check 48 cancer-causing genes, not just the 2 BRCAs, which someone like you, if you only have one mom with breast cancer, do you have other breast cancers and ovarian cancers, pancreatic cancer?
No. Pancreatic cancer, yeah.
On the same side of the family as
the other
breast?
side,
On the other
side,
side.
yeah,
Good. Okay, perfect. So you need, again, full panel testing because pancreatic cancer sits on a lot of cancers. So you check for the 48 cancer-causing genes, which is unlikely that you would have it, but you don't know until you do it. So that's the first information you get from the MyRisk test. The second, they calculate your Thaïs risk score. Thaïs basically takes your height, weight, age at menarche when you first got your period, family history, density of your breast, how old you were, all of that. You punch it in and it gives you a percentage. If that percentage is 20% or more, that automatically pushes you to a high risk category, which means starting as early as 30, you need to do mammogram, ultrasound, and breast MRIs annually. And I'll talk about it when it comes to hormone replacement. And the third information you get from Myriad is a risk score, which I love that. And I would absolutely recommend for you to do it. I'll tell you why. Because in addition to the 48 cancer-causing genes, which you're not going to have, and they're going to put it aside, they look in your DNA for tiny little markers. These are markers that individually, they're not going to hurt you. But some of us walk around with tons of these DNA markers that will push that lifetime risk up. Usually at a young age, when you have a mom, how old was your mom with breast cancer?
I was going to say you went back to the mammogram. So my mammogram started at 34.
Because she was
44 when she was diagnosed.
So when you have a mom at 44 diagnosed with breast cancer, I will guarantee you your lifetime risk hits 20%.
Yeah.
Okay. So which puts you in a category of starting at 30 with MRI because mammogram picks up 80% of cancers. And when you're high risk, you need breast MRI. So this risk score takes your Thaïs and the little DNA markers in your blood and gives a new score.
Okay.
Sometimes your Thaïs could be 22%. And then your risk score shoots up to 38%.
What do they do when you have a risk like that so high?
Very good. That's when it brings me back to hormone replacement. I want every single woman walking on this planet to know their lifetime risk of breast cancer. Because if you're at 22%, great. Anyone 20% and above, I do mammogram and ultrasound. 6 months later, I do an MRI. 6 months later, mammogram, ultrasound, 6 months. And you alternate every 6 months. That's number one. Obviously, no alcohol, no smoking, healthy diet, exercise, all the other things you can do to reduce your risk. But if you have a gene mutation, or if you have a risk score that shoots up to 40, 50%, and you're at menopause, it's my opinion, every woman can make a decision for them. But if you're my patient, then I would not give you hormone replacement therapy. These patients will benefit from an anti-estrogen therapy that basically blocks these estrogen receptors.
Which is tamoxifen, or what is that?
And it reduces their risk for over 10 years by 50%. So if you start at 40%, I can bring that risk to 20%. Now, a lot of women, as you know, having gone through menopause, they show up at 50, 49, and they have all these symptoms, and you really need to give them estrogen. But then they have this CHEK2 mutation that's giving them a 50% lifetime risk of breast cancer. For those patients, I offer them a prophylactic double mastectomy when it's that high. And as soon as they do their surgery and they have their reconstructive surgery, then I give them the estrogen patch. So that's why I say it's so important when we talk about menopause, not to just, it's not like a blanket you can throw at everyone and say, let's go, everyone get hormone replacement. For me, if you come to my office, I will know your breast cancer risk score, and I will definitely know your genetic markers before I even talk, because it's important, right?
Right. I mean, I think it's important to note too, though, that most women don't even know to go to the. I mean, we got to get to the first step before we can get to the second, right? And so that's why I feel like what's so important in the education part of it is that, you know, there's some type of baseline, whether it's 38, 40, whatever baseline, 35 probably.
I say 25 genetic testing.
Okay, so 25 genetic testing. So by 30 going into it, you already know what you're going into. You're not confused about what your course would be.
Bravo. So at 25, I do genetic testing, because for BRCA patients, you start imaging at 25. But at 25, if your lifetime risk is really high, I'm going to recalculate that at 30. And if at 30,
why do you recalculate? Is it because it could change your lifestyle factors?
As you have less life ahead of you,
I want to come spend a day with her.
It's amazing. I'm telling you. But that's why we started the podcast. We have to take all of this into our own hands.
You have to empower women.
And it's what you're doing in the book, in the documentary. It's what we're doing in the podcast and Ovi. If the system fails you on such a level, it has failed women, especially in menopause. So I think
there's no time to even catch up right now. Like we have to do it today. We can't wait for 20 years.
So I want to say two more things.
You're educating everybody and sitting around here.
No. Because it's important. Because we talked about hormone replacement and giving it to women. So number one, lifetime risk of breast cancer, genetic testing. You have to know what it is. If it's high, you can either go on anti-estrogen, not hormone replacement, but the opposite, or do a double mastectomy and do your hormone replacement. So that's number one. Number two, patients with a family history of dementia. 20% of the population carries an ApoE4 gene. I carry it.
Me too.
And if you carry the ApoE4 gene, you will benefit from hormone replacement. For example, if you go through menopause at 50 and you show up to my office at 65 and I diagnose you with ApoE4, then the benefit of HRT for that dementia is gone. So that's why if you're my patient, I always know whether or not you carry the ApoE4 gene. Because if you don't have symptoms, I still encourage the hormone replacement. So that's number two. Number three is coronary artery disease. So as we know, when plaques form in our vessels, sometimes these plaques break. And when they break, for women who are predisposed to clotting or thrombosis, a clot forms and then they get blockage of that vessel that can be very, very dangerous. So taking a history from women is very important. Generally speaking, my patients, if they have no family history of coronary artery disease, at 45, I do a coronary calcium scan to make sure they don't have any plaques in their heart. However, right now through Boston Heart, I don't know if you've done the Boston Heart labs or Cleveland Clinic labs. These are labs that basically look at the lipid profile, not just looking at cholesterol, LDL, and HDL, because we don't care as much. Exactly. So they look at your ApoB, lipoprotein little a. For example, you and I, we both have the ApoE4 gene, which increases your risk of having dementia. However, the ApoE4 can also cause increased absorption of cholesterol and delayed resorption of it. So what happens, these patients with ApoE4 have a higher chance of inflammation, higher chance of stroke, and they tend to have higher lipid panels. So these people, like us, are at a higher risk of coronary artery disease. Then you add, I have the lipoprotein little a, which is also 10% of women have it, and it also increases your risk of coronary artery disease. So if you have someone like me who has the lipoprotein little a, ApoE4 carrier, so I already have a high risk for coronary artery disease, I always, before I start hormone replacement, I always send patients like myself to a cardiologist. And on top of that, we check the ApoB. I'm sure you heard of it. So ApoB is a basket of all the bad particles in your blood that cause plaque. You put all of them in one basket, right? So the ApoB is more important than just looking at one LDL value.
Wow.
And you want your ApoB. Some doctors wanted less than 60. Some doctors wanted even less. My ApoB was 140 or 120. And look at me. I've always been thin. I don't smoke. I don't drink. I don't do drugs. Do you know what I'm saying?
You eat a lot of cookies.
But no, I don't. But I have the I have the lipoprotein and the ApoE4. So patients like me, it's better to be like, I'm okay giving them hormone replacement, but I would always recommend for them to see a cardiologist. What's your ApoB? Are you positive for ApoE4? Do you have lipoprotein(a)? What are your risk factors for coronary artery disease? And let me tell you, even with those patients, if you treat them and you stabilize their plaque formation and you know that they're not making new plaque, go ahead and give them hormone replacement. If someone's really high risk, I clear their cardiac scans before I start them hormone replacement, or at least have them see a cardiologist. Right now, patients come and they're like, my cholesterol. I'm like, what's your ApoB? Because ApoB is the collection of all those bad particles that make plaque. So again, if you know your lifetime risk of breast cancer, you need to know what your ApoB is. You need to know what your lipoprotein(a) is. And these are all available right now. And the tests are not that expensive. We did a podcast.
Yeah, we did a podcast about those. My next question is, can you take hormones for the rest of your life?
Yeah. If it makes you feel better.
Okay.
Do you know what I'm saying?
And the brain fog, does your brain come back?
It helps a lot. You feel like a fog gets lifted.
Okay.
For me, when I was diagnosed with breast cancer 5 years ago, they give tamoxifen. So imagine, I was 48 and a half premenopausal. And on top of that, they give me tamoxifen. Oh my God. I called my neurologist friend.
Estrogen out every which way you could.
All of it. And I was like, I have dementia. I'm losing my mind.
I can't imagine.
It is the worst thing. And when I stopped it, it feels like, but the opposite, obviously, I will let you answer because you've done so much research. You've talked to so many menopause.
I think it's a fascinating conversation because the whole thing is already very confusing, right? So if you go to a doctor and you, the doctor's not 100% convinced that they want to put you on hormone therapy. That's where the problems, I think, really begin, which is why what we've tried to do is educate the women. So when they go in and find a doctor that's not listening or is not aware or is not doing all these testing, that
they could say,
hey,
I want
they know what to do with it,
or I want
to go somewhere else.
Yeah, or I want to go somewhere else. In the M Factor, one of the women that you had, which is incredible, is Omashadi Bernie Scott, and she's the creator of Black Girl's Guide to Surviving Menopause. I did not know that Black women experience more intense adverse menopause symptoms. And she sort of described it, it's almost like sometimes it's trauma and then in menopause, it kind of manifests itself. Can you tell me a little bit about learning anything in that?
Yeah, I mean, you can address that more. I think what's important to know is that it's not everyone doesn't experience menopause the same way. And there's been research done, not enough research done, but that Black women often go through menopause earlier, have more intense symptoms, and often last longer. And so that was really why in the documentary, we wanted to make sure that we talked to so many different women. We talked to women who went through early menopause. Omashadi has been incredible in helping advocate for women because there are so many different stories of women that we have not heard, not paid attention to, and the research is not there, quite frankly. It's just not there. And Dr. Sharon Malone says it best, like, we can't wait 20 more years for another study. Like, we have to start helping these women right now. So it was important for us to not only talk to women, but talk to providers, and then talk to providers in different areas, whether it was with regard to sex or neuroscientist Lisa Mosconi, or talk to people within the workplace too, because of the places that menopause hits. It's not just in the doctor's office.
Momentous emphasizes convenience and effectiveness with products that integrate seamlessly into daily routines. Founding the SheMD podcast and Ovi has been one of the greatest gifts of my life. As an entrepreneur, I know that performance is everything, not just in my work, but in my health too. Long hours, constant problem solving, and pushing for that next big win. It all demands mental clarity, energy, and resilience. That's where Momentous comes in. Momentous is a human performance company dedicated to creating high-quality supplements designed to enhance both body and mind. Their products are science-backed, rigorously tested, and include transparent ingredients to support various health and performance goals. Momentous creates elite-level supplements designed for high performers like us. Whether you're an athlete or just need to bring your A game every day, they nail the basics with absolute precision. Their CreaPure creatine is the purest form available, helping with both physical and cognitive performance. And they just don't throw out trendy supplements. They only offer scientifically backed, NSF-certified products trusted by all 32 NFL teams and top college sports dietitians. If you're ready to perform your best, go to livemomentous.com and try it today at 20% off with code SheMD and start living on purpose. Let's talk about flying. I love to travel, but every time I step off a plane, my skin feels like it's been through a desert. Dry, tight, and just not happy. But lucky for both me and you, I've come across a brand called Dende that is making my skin so happy. Dende is a clean, clinical skincare brand powered by biotech to support skin health and longevity. Their products focus on skin health, not just quick. Their recently launched Line Smoothing Eye Cream is a lightweight, rejuvenating eye cream that is clinically proven to improve the look of fine lines and improve skin texture and smoothness. I love things that are clinically proven. It's super lightweight and absorbs like a dream, so I can use it before flight, mid-flight, and right after landing to keep my skin hydrated and smooth. It also helps fight something called inflammaging, which is basically the hidden everyday inflammation that speeds up aging. It's 15 times more effective than niacinamide at preventing future damage. If you travel as much as I do, or just struggle with dry skin, you have to check it out. Right now, Dende's offering 15% off to SheMD listeners at dende.com. That's DEINDE.com by using the code SheMD. Your skin will thank you. Trust me. Okay, guys, I'm so excited to tell you about Pulse, Netflix's newest heart-stopping medical drama. I love television. Every single one of my friends, every single one of my children, my husband, they know that my way to decompress is by turning on a great TV show. And I'm so excited to tell you about this new one. Welcome to Pulse, where the biggest disaster isn't a hurricane tearing through Miami. It's what's happening inside the trauma center. In the ER, every second counts. Every choice is life or death, and every secret comes out eventually. Dr. Danny Sims wasn't supposed to be in charge, but when her mentor, Dr. Xander Phillips, is suddenly removed, she's forced to lead in the middle of a catastrophe. The ER is overrun, the hospital locked down. The team is on the brink of collapse. But the biggest storm? It's the one brewing between Danny and Xander. Because their past isn't just messy, it's dangerous. And when tensions explode, so do lives. This is not your typical medical drama. It's chaotic, intense, and impossible to turn off. It has everything. It has drama. It has romance. It has danger. It has life and death situations. It's every single thing I love to watch on TV. So if you love fast-paced, high-intensity dramas with characters you can't stop thinking about, watch Pulse, premiering April 3rd, only on Netflix. The other thing that blew my mind is, and I knew this, but I hadn't seen the numbers in front of me, approximately $5 billion in federal funds were allocated for research on women's health. Of this amount, menopause research received $15 million.
It's unbelievable.
I'm surprised it received that much.
Yeah, you thought right. That's a good number compared to what we thought. Yeah, it's pretty disturbing.
And 20% of the U.S. workforce is now going through active menopause.
Yeah,
I mean
which actually makes a lot of sense to me when you think about that.
I think
we
it's
can see it
everywhere.
in each other, which is a good thing.
Yes.
Which is nice that we're so aware of it.
Yes.
Right?
Well, you know, this is a funny story. So my sweet husband, he hates it when I talk about him on the podcast, but he's my second husband, and we've been married now 12 years. And when I started having these symptoms, and I'm in perimenopause, I still have my period, but it's a little irregular. I was I was hiding it at first because, again, I'm from the South. Nobody talked about it.
Yeah.
But really because of this podcast, I feel so much more empowered. And also it's much more like, hey, this is who I am. I'm a woman.
Yeah.
This is the phase of my life. Like, da-da-da-da-da. But at one point I told Thaïs this, and I might have said this on the podcast before, but he sat me down like very seriously. And he goes, I think you really need to go see the brain doctor because I think you're getting early dementia. And I was like, Tom, that's perimenopause. I have brain fog. He's like, because we have a conversation and I swear to God, like 2 hours go by and you're like asking me the same question that you asked me before.
It really does happen though. My husband's like, are you here? Are you here? Well, I'm talking to you. Are you here? And I was like, I am, but I'm over here and here and here too. So it's really, there's a lot there.
Honestly,
a lot there.
if they had to go through menopause,
please,
they'd
be,
yes.
Well, okay,
laid
so
out on the couch for.
So in the book, and I'm so excited about the book, you identify all 34 symptoms of menopause. 34 symptoms?
I've never counted them.
But they say there's more now.
Yeah, I'm
While we were
sure.
writing the book, some research came out, and it was done by a nutritionist and dietitian out of Canada, and she had documented and just surveyed and kept track of 103 plus. I was like,
I'm sure.
I don't even think we could tell anybody that, but we listed them in the back of the book because her research is coming out now, and it's fascinating.
it.
Makes sense though, because it just touches every part of your body, right?
Right. Head to toe. You always say head to toe.
Head to toe, it does.
And then
Less hair growth, though. I was telling my children,
I
like
love
the best part is your hair doesn't grow on your arms and legs anymore.
my hair still grows everywhere.
You're not
My
there
eyebrows
yet.
go like this, and I have to cut them once a week. It's horrifying. So also one thing that I'm so interested in, and you touch in the book, is sleep.
Yeah.
And how that is so affects us all. What did you learn about sleep?
Yeah, I don't know about you two, but I like kind of discarded sleep growing up. I'm like, I had 4 hours of sleep. I can exist on that. I just didn't give it very much attention, and I thought it was kind of a luxury if I got it. I came from a news background, so I
Well,
was
and
like,
also you heard that like all the really successful, high-powered men,
yeah,
they
4
only
hours.
sleep 3 hours a night, and so you were like,
That's so true.
it's exactly
yeah.
right.
And then me who was sleeping like 15 hours a day,
You feel like something's wrong with you.
Yeah, I was
and like you're lazy. And
yeah.
And so, I really dug into that with two people, with Dr. Shelby Harris and Dr. Chris Winters, because both of them just are really incredible with sleep. And I love doing interviews, and I mean, that's the research is what I've done my whole life, which is why I really enjoyed the documentary and then the book. But Dr. Shelby Harris, who I'm fascinated with because I love when doctors can simplify, and so I was like, we need it simplified for this book because this has to be brain fog proof. Like this book cannot be complicated,
Totally.
right? It needs to be brain fog proof because I can't write something that isn't, and I don't want to read something that isn't. So I said, I just need some like real actionables for this. And she goes, do you know what sleep hygiene is? And this was like, remember, it was a year and a half ago, so I'm writing this. And I said, I have no idea. And she's like, we're going to map out what you can do, make it very easy. And I think like the easiest things that I've done are go to bed at the same time, get up at the same time, which was really hard for me at one time, and then get outside first thing in the morning, which, is just been so great for my head in general. And then talk about different things that I thought were not important, like blacking out the room, making the room cool, adjusting the thermostat, little things like that. And then for me, hormone therapy, progesterone was a game changer for deep sleep, to stay asleep. Alcohol, like I had a crappy relationship with that of late, like that's kind of out of my life, and caffeine too late. But I came from a background of news, so we existed on caffeine and then went out later and had drinks. I was like, I am not prepared for perimenopause or menopause. So I got a real awakening.
Studies show the minimum amount of sleep that we all need is 7 hours.
Yeah.
That's minimum.
Minimum.
For brain health, for dementia, for cardiovascular protection, for all of it. And as you go through menopause, because your sleep is disrupted, right? You're either having a night sweat, you're having a hot flash, you have to get up and pee.
Or you just suddenly wake up for no reason at
You're
all. And
more
you're wide awake.
anxious.
Yep.
So you wake up. Exactly. So all of that disrupts it, which I don't advertise for these people. I don't even know what the company is, but the
I have
Aura
one too.
ring.
Mine's charging right now at home.
It's really, it
is
my
great.
physician assistant bought it for me for my birthday. And honestly, it's one of the best gifts I've received. I only use it for the sleep portion of it.
Yep.
Because I have the all the gene mutations that will predispose me to all these conditions. So I try to use it. It's been a game changer. And, one thing I learned over the years is midnight should be middle of the night, middle of your sleep. So
I love that.
So
I
for
didn't hear that.
people who go to sleep at 11:30 at night,
Right.
that's
So
not
that
a
should
good
be.
idea.
So what
because
time
it's
should you,
hard
what's your
to
ideal bedtime for you? Do you have an ideal?
if I
know.
force myself.
You do not. This is She has to
I'm
go
a bad
deliver baby.
example.
I mean, she's
Oh,
delivering
you're-
babies
yeah,
in the
you're
middle of
not
the
a
night.
good example.
She's sending
Okay.
me texts. I don't. No. You cannot give this advice.
If I
cannot give this
force
advice.
myself, I would go to bed at 9:30. The problem is
Okay.
my phone keeps beeping.
Yeah.
But ideally,
You need
I
to read
want to
this
be
chapter.
sleep. Yeah, 100%.
I'm gonna it's
At
brain
10
fog.
p.m. Yeah, because I wake up early. For people who
Yeah.
wake up early, you have to go to
You have to
sleep
shift it back
earlier.
more.
But I think ideally, if you can go to bed at 9,
Yeah. No, I know. It's funny when I'm here in LA. Everything closes down really early here, I've realized, compared to New York. So I'm like the perfect sleeper in LA. And then in New York, everything goes to crap.
because you're out.
That is amazing. People don't know
It
that about
is.
LA. People
I
go to bed
know.
early. We go to dinner. If I'm at dinner at 8, I'm like, what? Somebody
It's
wants me to be at dinner at
crazy.
8? Are you kidding?
I know.
And
I
the
know.
other thing is, as we get close to menopause, you get urgency because of
Yes.
that lack of estrogen.
Yes.
Vaginal dryness can actually affect your bladder. So if you're peeing a lot, if you get to the bathroom and you can't hold yourself, it could be caffeine related, but it can be vaginal dryness. So treating the vaginal dryness can fix that. But decreasing caffeine. So if you were younger and a reporter and you were having 4 cups of coffee, as you go through menopause, you can't do that because
can't
if you
tolerate
keep
it.
doing that, A, it's going to disrupt your sleep. B, you're going to start peeing on yourself because your bladder starts going.
I haven't done that yet. It's
I
just-
know.
I do when I'm exercising and jump up and down.
But
All of us do. We're like,
That's stress incontinence. So
Oh.
there's 2 types of incontinence, stress and urge incontinence. Stress comes from childbirth and lack of
okay.
estrogen, and
Okay.
it's more anatomical. Urge incontinence is when your bladder
have to
starts
go to the bathroom.
contracting
Yeah.
without the control of your
Right,
brain.
okay.
And for that, there's no surgery for that. But cutting out caffeine stimulates that.
Okay.
Estrogen, vaginal dryness can stimulate that. So fixing vaginal dryness, cutting caffeine
Vaginal
can help with
estrogen.
your bladder. Vaginal estrogen can help with your bladder symptoms, so you don't have to wake up.
Yep.
But if you still wake up, then we give these patients a low dose of a medication like Myrbetriq or something that will relax the muscle of the
What are those?
bladder.
Like a sleeping pill, or are they?
No.
What are
They only affect the bladder muscle.
Oh, for the
so
bladder
it
muscle.
prevents
Okay,
it
I
from
understand.
squeezing. No, it has
Got it,
nothing to
got
do
it,
with your
got it,
brain.
got it.
But so it'll relax your bladder so it can fill up. So instead of contracting at 80 cc's,
Yeah,
it'll
yeah.
let you go to 250
longer.
cc's
Yep.
before sending a message to your brain that you need to wake up and go to the bathroom.
what do you want women that are going through perimenopause or menopause to know?
I think I want them to know that they have to take that power back, and they have to know what's going on with their bodies, because I don't think that they can count on anything with the system right now, and I think they've got to know that, and know that they're not alone going through it. I think what surprised me the most was the lack of education doctors were allowed to get or got. And I think that makes me the saddest, but I think that we're learning how to work around that right now by educating women, by trying to figure out how to get, continuing medical education into some of these schools, and then to go forward with telehealth. I mean, there's different solutions that we're doing workarounds. I'm hoping in 5 years, 10 years, we're having way different conversations about this, or not at all, and that it's normalized. And I think that that's probably what really put me on that journey. I didn't have my mom. My mom died at 51. So I didn't have anyone to talk to about it, and didn't realize, because she had gone through breast cancer and double mastectomy and had radiation and chemotherapy, that she was put into an early menopause. And I would see her sweating all the time, and we'd all joke about it. She would joke about it.
So hard.
And now it makes me so sad
So
to realize
hard.
that
It's
was
so
what was
hard.
happening in her life alone.
So hard.
I feel so encouraged that women like you, all the women that you had on your documentary, some of them we've had on the podcast, doctors like Dr. A. I mean, we're changing the conversation, and we
sure.
are educating women, and we hear from them all the time. Oh my God, thank you so much. I know what to do when I go into my doctor's office. And I think the book is really going to be so impactful too. So we're so honored that we had you on our
Thank you
podcast,
so
and we
much.
can't wait for your book. How do they find the book?
The book is howtomenopause.com or anywhere books are sold.
And your website is?
TamsenFadal.com.
Okay, spell that for everybody.
Yep. TamsenFadal.com.
And we're going to have links to all of this on our own site for your episode.
Thank you. Thanks for having me. Really.
Thank you for coming.
Thanks so much for joining us today on SheMD.
If you want to own your own health, a good place to start is by following us on social media at SheMD Podcast and by subscribing to our show on YouTube or wherever you get your podcasts.
For takeaways from today's episode, visit our website, shemdpodcast.com. We'll see you next time on SheMD. This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SheMD, some of the products and services we discuss may involve sponsorships or paid advertising.